At our last board meeting, I happened to mention to Jim about I was a member of Samaritan Ministries, an alternative medical program, and he looked into it and said, yeah, why don't you talk about it to the group? So I just want to tell you a little bit. Mine is about 10 minutes here. So about 2 years ago, I needed to find a new medical carrier insurer because I'm self-employed. My premiums have always been really high, even though I had insurance through the Chamber of Commerce. The high deductibles, in order to decrease my premiums, really didn't work except for the 1 year that I was really, really sick. Also, as I became more involved in the pro-life movement, when I checked my health care provider, I found out that my premiums were being used to help fund women who aborted their babies. Early in 2010, when I got a notice of a 39% increase in my premiums for the coming year, I knew I had to make a change and find a new carrier. Well, however, with those pesky pre-existing conditions I had, no one would carry me. So it was going to be pay more than a half of my monthly earnings for insurance or go without. I almost opted to go without. Now, many of you may be in similar circumstances with nowhere to turn. Fortunately, my husband, curious as to how a friend of ours could afford specialized surgeries for his young son who needed procedures at Boston's Children's Hospital, he asked him what kind of insurance he had. Because you see, this friend heads a not-for-profit organization, and we know his donations have been decreasing in this economy. His family lives on a very meager income. He told us, well, we're members of Samaritan Ministries. Why don't you check it out? So we did. So what is Samaritan Ministries? Well, it's a biblical idea whose time has come again. Some might say it's a Christian health care co-op. Let me explain a little bit more. Many in our nation's history were used to bearing one another's burdens. There was a time when if a neighbor's barn burned down, his relatives and friends would come together to help him build a new one. Think of the Amish people. They knew this burden was too large to be borne alone and that they too might need similar help someday. There was a barn-raising mentality that was rooted in Scripture. Galatians chapter 6, verse 2 tells us, "Bear ye one another's burdens and fulfill the law of Christ." Samaritan Ministries applies this biblical mentality to the medical burdens of fellow Christians. It's a complete approach which combines financial aid, encouragement, and comfort from fellow members. The ministry emphasizes one, Jesus Christ is the only adequate provider for every need we have. 2, a medical need involves more than just money. 3, believers in Jesus Christ are responsible to use first the resources he has given us to meet the needs of ourselves and our family. And 4, the local church should be the first human line of defense to provide for the needs of its members. So how does the Samaritan Ministry program work if it's not a health insurance company? Well, every month, nearly 20,000 households of Samaritan Ministries members share more than $5 million in medical needs directly, one household to another. They pray for one another, send notes of encouragement. The monthly share for a family of any size, as of June 2012, is no more than $355 and is less for singles, couples, single-parent families, or elderly. There is a yearly administration fee that is paid to the company, but my monthly share, along with a note of encouragement or comfort, goes directly to a person in need. A published letter comes to me with a person's name and what their medical need is, and I send my money directly to them. When a time comes for me, my medical need will be published and sent out to those who will then send their monthly share to me. In fact, you may even find it financially possible to send more money to a person that you feel might need a little bit more financial need. Members give only what really happens, but not for what might happen in the future. Unlike an insurance company, Samaritan Ministries does not keep a large financial reserve, and the direct approach keeps administration fees low. Members agree to live in a way that reduces health problems. They agree not to abuse alcohol, to abstain from illegal drugs, not to use tobacco, and to stay the course in traditional marriage. Samaritan Ministry members will help with their share to help pregnant mothers, new babies, miscarriages, but they will not pay for abortions or contraception. In addition to the regular membership sharing, which goes up to $250,000, there is another program called Save to Share, which covers medical costs that exceed $250,000. They also have a prescription program. You get a card, which you can get some discounts when you go to pharmacies. And recently, they have started a crisis pregnancy center, and they plan to do more around the area. Not necessarily in our area right now, but around the country. It started out in 1994 with an idea of one man. His name was Ted Pittenger. He banded together with 20 people and tried out this concept. By 1997, there were 300 members and 3 people on the staff who were being paid. When I sent in my application, there were 14,000 members. A year and a half later, there are 20,000 members. People see the beauty and logic in this faith-based concept. Let me read you a letter that I received from a couple that I had sent my monthly share to. To our Samaritan Ministries family, we want to express our gratitude for the cards, heartfelt personal words, financial gifts, scripture, and general encouragement Guy and I received from all of you. We have been quite shocked by the response from the special prayer need that was published in the newsletter. Every time we thought we couldn't be surprised anymore, we were. We are so appreciative of the financial sacrifice made by you in an endeavor to help us cover our medical costs incurred from the motorcycle accident Guy was in. We couldn't help but shed tears as each individual card was read. It has been astonishing to experience through this tragedy how the Samaritan family takes care of one another. Quite humbling, actually. Many of you asked how Guy is doing. He has had a remarkably quick recovery in many aspects, and we trust it to be complete in the days and weeks ahead. We started out writing individual thank you notes, not realizing there would be hundreds to write. So we're sorry that we needed to resort to a mass newsletter. With deep appreciation, Guy and Judy Fance. So you can see it really works. I recommend that you check out Samaritan Ministries, join the growing number of Christians who have discovered this big biblical, cost-effective way of dealing with our healthcare needs. Trust and obey God, and He will provide. If you have questions, I will be here after when I'm finished here. I also have in the back, or as you came in the meeting, there were cards on the table. This is a really quick thing to check out. It has their 800 number. There is a website to check out. And also, I have brought along some folders. Any of you who are maybe serious inquirers, I have 10 folders up here on this table. There is a DVD inside that you can look at. There's lots of information in here. It tells you how to get started. And these people, when you call with a question, they are just really wonderful people to work with. So there's a lot of other things that maybe you have questions about, but see me afterwards. And if it's not for you, perhaps you want to take one of these papers or a folder for a friend or somebody you know who might benefit from this ministry. So I appreciate the time and let me speak to you about this. Thank you.